Welcome. I'm Francesca Borges Gordon, class of 1982 and president of the Trinity Club of Hartford. I'd like to thank all of you for joining us tonight for our Trinity College or Trinity Club of Hartford virtual speaker series. You are among alumni from around the country that are joining us over the past several months. We've resorted to virtual presentations, which have been very well received. And quite frankly, not only is alumni from around the country, but it's alumni and friends and parents from around the world who are joining us tonight. Tonight's talk is Emerging from the Pandemic. And I think you're in for a real treat with our esteemed panelists tonight. Our moderator for this evening is Matt Smith, class of 1982, and a member of the Trinity Club of Hartford. And as we call him, the architect of our Trinity College Speakers Series. Matt.
Thanks, Francesca. Good evening, everyone. Thank you for joining us for the second event in the Trinity Club of Hartford's 2021 Speaker Series. Our talk will be followed by a question and answer session. So to participate, please type your questions in the Q&A box at the bottom of the screen. The Trinity Club of Hartford Speaker Series is dedicated to informing and educating members of the Trinity College community about issues central to Trinity's vitality. The objective of the series is to provide an honest view of an issue from an informed perspective. For this talk, we are focusing on emerging from the pandemic. COVID-19 and the extraordinary events of the last 15 months have altered our ways of living and working, and in some cases, our values. Emerging from the pandemic poses unique challenges and opportunities. To discuss them, we have a distinguished panel of speakers. Each brings deep insight into their area of expertise. Paul Mounds, class of 2007, is Governor Ned Lamont's chief of staff. He brings a government and statewide perspective to the discussion. Glendolyn Thames, master's class of 2013, will share her point of view as Deputy Commissioner, Chief Operating Officer, and Chief Financial Officer of the Department of Economic and Community Development. Jeff Flax, the class of 2021's commencement speaker and honorary degree recipient, as President and Chief Executive Officer of Hartford Healthcare, has the unique view from the intersection of health and business. With that introduction, I'd like to invite each speaker to open the discussion by addressing the question, what steps are being taken by government, business, and healthcare to emerge successfully from the pandemic? I'd like to ask Paul to begin the conversation by taking 3 to 5 minutes to share his thoughts, followed by Glendolyn and Jeff. When each speaker has concluded their opening comments, please ask the next speaker to begin. I will begin the question and answer session once Jeff has concluded his comments. As the speakers begin the discussion, I ask the attendees to please type any questions into the Q&A box at the bottom of the screen. So with that, Paul, I will ask you to start the discussion.
Great. Well, thanks so much, Matt, and thank you, Trinity Club of Hartford, for inviting me to this speaker series here to be here with not only colleagues, but individuals who I consider as friends, both of whom myself in this role as Chief of Staff for Governor Ned Lamont worked very closely with as we dealt with the overall response to this global pandemic here in the state of Connecticut. So how is the state looking to emerge after what we have seen and what we have discovered and dealt with? There's still a lot of work left to be done. The first thing that had to be focused on by the state, and that's really working very closely with our health partners, is how do we ensure that we have individuals who are not only prepared to deal with this from a health perspective, but also are getting access to readily available vaccine. The state of Connecticut has worked very closely with our health partners to ensure that we have vaccines that are available to anyone and everybody here in the state, no matter where you live, and no matter your abilities through car or bus, transportation options, making sure that it is something that is not only available to you, but also you have the information so you can feel comfortable getting it. We are lucky enough that because of this work, the state of Connecticut has always been top 5 in the nation when it comes to getting individuals vaccinated. There's still much more we have to do, particularly in our urban and rural areas. And that is something that we are working very closely with our healthcare partners, particularly Hartford Healthcare, to ensure that we reach that ultimate goal. We have opened up the state And I know that many people have said the state of Connecticut has taken a very cautious approach. I would say that we have taken a very data-driven approach about how best to open up the state of Connecticut. And it really started with ensuring that the behaviors of individuals took account that we needed them to be a partner with the state through this process. So what the state did particularly is provide information, but also use best available information, not only from our best researchers within the state in our academic fields and our healthcare fields, but also working with our regional partners. We started a 7-state collaborative. It first started off as 3 states with New York, New Jersey, and Connecticut, and then it grew to really represent New England and the Mid-Atlantic states. We were able to actually make decisions about how best to reopen, when to actually tailor down based upon where the virus was going in our various states in the region. We'll really do it in a collaborative fashion. Now, as we are at this point where we are considered open, while people will say we're back to normal, we truly are not. And that's why it's very important from the state of Connecticut's point of view, is that we continue to provide the best available information. We continue to provide the best available data, and we continue to provide the ability for individuals to know that their health and well-being is top priority for the state. And I know I could talk about some of the things that we're doing on the school side and the business side, but I know Gwendolyn will talk on the business side. But we have been really trying to focus on how best we can get back to what a normal is, but understanding that a new normal was in front of us. And that in dealing with that new normal, we have consistent challenges that we've had before that has now only exacerbated because of the crisis. Here in the state of Connecticut, we are going to see a large amount of our employees who are going to retire. And we have to really take into account what that means for overall services and overall keeping what the role of government is in the state while we're dealing with a burgeoning retirement that will come upon us. So we see this as an opportunity to not only invest within our agencies, but also to evolve and to innovate within our agencies, whether it's through our social services mechanisms, whether it's through Department of Children and Family, whether it's something as the DMV and understanding the importance of the technology side. We have seen that because of the COVID crisis, where we've had the state of Connecticut employees working basically remotely, which was something that was new and not really seen in the States, that we can see this as a great opportunity for great innovation. This was a very tough time over this past year. I can speak personally. I'm someone who took over my role as chief of staff a week before the first coronavirus case. There's not a playbook for this, and I know Gwendolyn and Dr. Flax will say the same. But the one thing that we saw is just the perseverance, particularly of the people of Connecticut, to want to band together and work together to ensure that we get through this together.
Thank you first and foremost to the Trinity Club of Hartford for hosting this conversation and allowing me to participate. It's always good to be with fellow Trinity alums. And just kudos to Dr. Flax and Paul as colleagues, friends, and really just partners navigating this crisis, because leadership matters. And without leaders like Dr. Flax, like Paul, we would not have had the success that we've had in Connecticut to ride this storm collectively together and really helping our residents and our businesses and our stakeholders more broadly. So I just want to publicly say that. And then personally, never could I have imagined, right, in taking this job in mid 2019, 6 months later, be faced with a pandemic and having to shut down an economy and then reopen an economy. Never could imagine in my wildest dreams, but nonetheless, we were where we were, and we really were building the plane as we went. And so, as Paul stated, we've all, been in this collectively over the past 15 months, and really collectively, arm in arm, trying to do the right thing and get our communities back and getting our economy moving again. And so, again, I think just kudos to everyone for that collaboration. And so with that said, I think for us, we've been in crisis response mode for, again, the last 15 months. And so now, over the last couple of months, that we've started to turn the corner, and our vaccination distribution has gone very, very, very well, especially compared to other states, and being the number one state, or the first state in the nation to have 70% of our population vaccinated. We are really now starting to really look at, okay, how do we assess where we are from an economic perspective, and where do we go next? And what does the next economy look like? What does the next normal look like? A lot of which we don't know, right? We're still kind of monitoring that, and we're still kind of navigating through that. But what we do know is that there was a severe impact on our economy, and a disproportionate impact of COVID on our economy, particularly to our urban centers and our underserved and historically marginalized communities. And so with that in mind, we know that we need to use this moment and lean into this moment to really make transformational and sustainable change. And so as we look at what's next, we really need to restore jobs, right? And so they're at the highest point, 1.2 million residents applied for unemployment. We lost over 160,000 jobs. And so how do we restore those jobs back? We need to build our communities. Many of our communities and our main streets really suffered. When you look at a city like Hartford, where Trinity is, we're primarily a commuter city. And so you look at downtown Hartford and the Central Business District, a lot of those office workers, events via the Excel Center, the Yardgo Stadium, they weren't there. That foot traffic wasn't there. And so there was a lot of retail and businesses that suffered as a result. And so what does that, again, next norm look like for our communities? And then growing our economy and trying to get back to a position of growth and creating new value through new opportunities and new investments. And so with that said, I think we're looking at 4 kind of pillars from an economy perspective, and that is support for workers. And so we are really making significant investments in our workforce development. One of the glaring issues that we saw was, as we saw all of these dislocated workers apply for UI benefits, we're looking at, okay, how can we quickly move them to other sectors? And we recognized that we had a significant amount of job openings available. So there was jobs open, but the individuals that were dislocated didn't match the skill set. So there was a skills mismatch in our workforce, in our pipeline. And so we quickly had to make investments to reskill, retool up individuals. And so we're going to continue to make investments in our workforce development efforts, and working with the private sector to inform what their needs are now and what their future needs are going to be from an employment perspective. Shoring up our UI insurance fund and ensuring that our unemployment insurance fund can improve its insolvency. So that's something that, again, is supporting our workers, and just the continued unemployment support that will be necessary. I know we hear news about employers not being able to get people back to work, but there's a variety of issues why people are not going back to work. And it's not necessarily because, they're getting more in UI benefits than they would if they were working. Personally, my niece, she's a single mom. She had a young child in the midst of the pandemic, and she got offered to go back to work, and she wants to go back to work, but she's trying to look for childcare, right? And affordable childcare. And so that is a real concern. So it's not that she doesn't work, but she's trying to get affordable quality childcare so she can go back to work. So there's many factors in that situation. The next is support for business. We are really going to be ramping up our efforts to ensure that we're building an ecosystem where our small businesses can thrive. And that is new business creation as well as expansion. And so really working with our private sector banks, foundations to provide access to capital, as well as technical assistance and development to, again, help our businesses grow and thrive in our state. Also, really owning our narrative, right? We really got a reset, I think, with Connecticut's public perception. And so we really want to spend more and invest more in our brand and owning our narrative. And so we're going to be making sizable investments in that effort on really promoting Connecticut to our existing residents and all of the diversity of attractions we have, but also to external visitors, right? Come visit Connecticut. We have coastal lines, we have mountains, we have hiking trails, a diversity of experience that you can have. And to employers, right? This is a great place to have your business. You can get quality talent. And so we want to lean in there and really own our narrative. The next piece and the third pillar is really support for our communities. I touched on this a little earlier in looking at the challenges that many of our main streets and particularly our urban centers have faced as a result of COVID. And so really providing development dollars and infrastructure dollars to support, again, that quality of place and really place-based economic development, because quite honestly, we're living in a world now where people can live anywhere and work anywhere. And so we have to be in the talent game. How can we attract talent, retain talent in our state? And that's investing in our communities where people want to live, work, and play. The last piece is really some support for our families. And that is where we talk about early childcare and really investing in our system of affordable and accessible childcare. We lost a significant amount of capacity for childcare seats during COVID. And so how do we restore those and then build a system that is more accessible and affordable to get people back to work and gainful employment, if you will. And then the last piece there is just the housing piece. We know that housing is a huge fundamental element for families, right? And having secure, safe, clean housing. And so we know the moratorium on evictions is coming to an end. And so to combat that and mitigate that, we're really going to be putting resources into tenant eviction and legal representation for foreclosures to really mitigate a lot of those issues, and also really investing in our housing stocks and stabilizing good, modern, affordable housing for our families. And so all in all, I think, this really represents how we see a holistic view of how we emerge from the pandemic, but a lot of things are still unknown. And so we're closely monitoring. We're looking at the trends. We're talking to our private sector partners, businesses, both large, medium, and small, to really continue inform the public interventions that we need to take to ensure that we can emerge and get back to a position of growth, if you will. So I'll stop there and hand it off to Dr. Flex. Thank you.
I'm inspired by your comments. And, I have to say, first of all, we worked very closely with President Burger-Sweeney throughout this crisis, and the leadership, administration, the faculty of Trinity College were exceptional throughout this crisis. During the pandemic, we provided testing, supplies, various medical services to the campus, as well as some planning around their policies and procedures. And at every turn, they certainly tried to make the best decision, the safe decision, but the decision that was in the best interest of the community as a whole and of the school. And it really was absolutely remarkable to see. During this crisis, the state of Connecticut leadership was extraordinary. Paul Mounds was an exceptional leader. Paul worked, literally 16 to 18 hours a day for a year and a half. And Paul, the governor, the other senior members of the administration, we owe an enormous debt of gratitude to them. I don't think anyone could fully appreciate that they were on call 7 days a week, each day, often making decisions with limited information in the early days. And what I found most remarkable was that the pragmatic nature of our state leadership. Paul, the governor, and the team, first they listened. They brought experts around the table, and they were listening and at the same time decisive, willing to make decisions and recognizing that those decisions were being made with the best information they had at the time they were making it, and possibly willing to adjust as necessary as more information would present itself. Gwendolyn said there was no book, for this crisis, and there really wasn't. But what was so comforting to me, having kind of a ringside seat to some extent, working so closely with our state leadership, was how well intended our leadership was. They did everything they could to protect our communities, what was in the best interest of our state, and it was completely a values-driven process. Our state did exceptionally well, and we led throughout the crisis at so many levels throughout comparatively to the country. And I think often it was because of the collaboration, the bringing people together, and the decisiveness of our decision-making of our leadership. And in this case, it served us exceptionally well. There was enormous alignment. And what I also saw was great agility. And my point of view throughout this crisis is in healthcare, so many parts of our lives, we want to go back to normal. And we are going back to normal as we turn the corner in many ways. But in healthcare, we're going to be better than normal, and we have to be better than we were. There were enormous lessons learned during this crisis, and we need to ensure that we emerge better and that these improvements are sustainable. I look at the areas around the disparities in healthcare, completely unacceptable. The way different communities were impacted, people of color impacted entirely disproportionately. These are longstanding chronic issues. The crisis shines such a bright light on them. It has to be better. And we're seeing a variety of ways during this crisis that we were able to do better. We built partnerships. Health systems like mine went into the communities, but we went into communities with trusted leaders within the communities. And we went through alliances that were created so that we could bring our services with community-based organizations through trusted leaders. In those vaccines, we delivered about 500,000 vaccines, over 1 million, nearly 1.5 million tests. And that was done by creating relationships and creating mechanisms to ensure that no community would be left behind. And from my perspective, one of the great learnings is you can't expect people to come to you in every instance. We have to bring our services to where people are, to where they feel safe and secure, and deliver them in a way that inspires trust. So the permanent improvements we're going to see in healthcare, begin with mobile health. The notion of mobilizing healthcare teams that we set up literally thousands of times, several thousand times, in churches, in homeless shelters, in prisons, in community centers, in parking lots with pop-up centers. And we were delivering vaccines and we were doing testing. But as we go forward, we should be doing diabetes testing that way, prostate health, breast health, bariatric screening. We should be doing blood tests. We can be doing a whole series of services delivered through that mobile health capability. So we should never see our mobile health vans off the road. And the teams that we built and trained to partner with community-led organizations should be distributed every day in multiple parts, of our cities, of our urban and our rural communities, so that we're creating access for people to affordable healthcare, and that we're providing preventive healthcare, and we're going to address these disparities. Secondly is virtual health. Right? So we went from doing about 400 virtual health visits per month to, at the height of the pandemic, we were doing almost 80,000 virtual health visits in a given month. Right? This should never go away, because why should healthcare be delivered 8 a.m. to 5 p.m.? And why should certain services only be delivered where you have concentrated population? But we now can make our services that are very specific and subspecialized available to every resident within our state, really 7 days a week and with significantly extended hours. So virtual health provides another mechanism to meet people where they are, to do it in a way that's more comfortable for people in many instances, and that removes significant barriers. And it's about access. Third is home health. We provided a tremendous amount of home health throughout this crisis. And we even began to put hospital beds in homes, provide infusion services in homes. So we took what was our traditional home health services and we dramatically enhanced them with much more intensive capabilities. This is a way to provide care more affordably, to provide it more comfortably for people with their loved ones, more accessibly. Another tremendous improvement. We should never scale back our home health capabilities. Home monitoring is going to dramatically increase. People will be able to have a lot of preventive services, on their wrist, through their camera. We're investing right now in services that can test for diabetes without even a blood test, but through the cornea that can be read through the computer. There's a tremendous amount of emerging capabilities and technologies right now. And our challenge, our job is to ensure we're on the leading edge and to make those available to our communities. Third is infection control procedures. It's never been safer to be in a hospital than it was in many ways throughout this crisis. We built new procedures. We strengthened historical procedures around infection control procedures within our hospitals. Those procedures now should never go away, and we should never have clinicians and caregivers doubt them because we know they work and we demonstrated the results. I mean, if you look in our communities last year, our state of Connecticut, you can count on one hand the number of flu cases that occurred within the state. There was tremendous learnings around prevention, around hand hygiene, around hygienic procedures, and around the importance of things like mask wearing. Our capabilities in critical care. Who would have imagined the ingenuity that we put in place? But when our ventilators were being overrun, the fact that we actually started providing split ventilator care, so one ventilator supporting two patients, would have been unimaginable prior to the pandemic. And it was becoming routine in the early days of the pandemic, while we were pivoting to acquire more, infrastructure, in this case, more ventilators. And the importance around personal protective equipment. Our organization actually had to build in the center of the state in Newington a new warehouse during the pandemic because we went from having about 60 days of personal protective equipment on hand, which was considered really a best practice at the beginning of the pandemic, to now we have about a year at the present use rates, which are considerably higher than the pre-pandemic levels. That's never going to go away. And at a national level, the country needs to advocate, and the congressional delegation and the governor are highly supportive of this, that we have a national stockpile for oil historically, and we were prepared for our oil, distribution channel to be disrupted, but we weren't prepared for our personal protective equipment to be disrupted. And our dependencies on personal protective equipment, the vast majority of ours in Hartford Healthcare, much of it was coming from Asia. Some was coming from Europe and Italy in particular. Today we're actually now sourcing our own raw material, and we're privately developing through special manufacturers unique personal protective equipment for Hartford Healthcare. So we've created our own distribution channel. And at the same time, we're sourcing much more local in Connecticut where we can. And we're dramatically enhancing, our and focusing our purchasing capabilities on where we can support, our region and where we can entice people to help support us with personal protective equipment. So there's tremendous benefits that we learned during this crisis that have to carry us forward. But the statistics you see on the state of Connecticut are no coincidence, and they really are a reflection of Paul's leadership, Gwendolyn and the DECD's leadership, and what the governor led within our state to distinguish us. And they galvanized all of our resources. So places like my organization, we're the second largest employer in the state. We didn't wear a uniform during this crisis. Our uniform was the state of Connecticut, and that was from day one. And that was the culture that Paul and the team created, which was, we're in this together. Let's just do whatever it takes. And I'll just give you one anecdote. I'm a very strong believer in the importance of regional integrated delivery systems, and that's our model at Hartford Healthcare. But in the early days when the pandemic came up through Fairfield County, we were able to take our hospital in Fairfield County, and we first took our nurses from our home care division, we took our nurses from our surgery centers, and we took our anesthesiologists from our surgery centers, as well as our ventilators from our community surgery centers, and we redeployed them to St. Vincent's, the hospital in Bridgeport, and we stood up the hospital. But when it really then began to even increase beyond that, we started moving patients to Eastern Connecticut and to Northwestern Connecticut, where the pandemic was moving more slowly. And our hospitals in Fairfield County were never at risk. They were never in jeopardy. And we were always able to provide the safest level of care. But even during that same moment, our health system deployed ventilators and nurses to Stamford Hospital, which is a neighboring hospital that is not part of our system, but a partner institution in the state of Connecticut. And that's what a large regional integrated delivery system, we had capacity to move people, to move equipment, to move resources. But in many ways, it took the state as a unifying organization. We set up a regional incident command center in those early days that was agnostic. So I wasn't looking at, do we look at a Hartford healthcare facility? The Stamford Hospital was the same as, in our case, Hospital Central Connecticut, New Britain was. It was just, what do we need to do, to support the different organizations. And I am a tremendous believer that on the other side of this pandemic, we're going to be safer. We're going to address the issues around access. Disparities absolutely are already being impacted and must be impacted as we go forward and must be measured. And then we have to work with the state for very targeted funding and very specific initiatives. And the state's been an outstanding partner in this regard and continues to be during this biannual budget that just got passed to invest in addressing these longstanding issues and making sure that Connecticut continues to distinguish itself. So, I think this is an important moment for us. And, I just am so grateful for the fact that, this was a tragic situation. We lost many lives. But absent the measures that were taken, it could have been so much worse. And on the other side, there'll be other pandemics where there is absolutely other risk. We are much better situated should it happen again, and we have to continue to have a permanent state of readiness so that when it happens again, we're ready in a moment's notice to deploy these critical learnings.
Great. Thank you very much, Jeff, Paul, Glendolyn. Wonderful opening. The questions are coming in. So I'm going to get to Janine Caddy's question right now for the three of you. You have mandated vaccines for all students in light of Israel and now the U.S.'s concern regarding the Pfizer and Moderna vaccines because of heart inflammation in young people, a worry that has warranted an emergency meeting of the CDC tomorrow. Because of Trinity's vaccine mandate, how can you be so certain that there won't be a severe or fatal reaction to some of the students? And I don't know who's best to kick that one off, but I think when it talks about a mandate, maybe Paul from the state level, is there something you can?
Yeah, no, I'll say this. I think the decision on the vaccination of students and faculty is one that was made at the Board of Trustees level at Trinity College. We know that University of Connecticut has made their recommendation on their Board of Trustees level. We have not made a mandate in the state of Connecticut. We are leaving that up to the institutions, school districts and such to make that. What we are focusing on is making sure that people are fully educated and understand the importance of getting vaccinated and providing that access to it. So I'll use this as a transition point to talk about just some of the work that we're trying to do, particularly right now, and Dr. Flax talked about in our more, I would say, hard to reach, harder hit areas. There's two things that's really facing those areas, particularly in cities such as Hartford, Waterbury, New Britain, New Haven, Bridgeport, I can go down the line, is one, a lack of comfort level of feeling about getting vaccinated. We are dealing with communities that have had not the most, I would say, consistent relationship when it comes to the medical field. But also there is also a community that does not readily go to get medical help as they need it. We're talking about in Hartford, I used to work at the Connecticut Health Foundation. One of the biggest things we used to push was making sure individuals identify a PCP and the importance of that. And making sure that they're identifying who's their primary care physician and setting up regular appointments and creating that ability. So now you're taking individuals who don't have identified PCPs, who really see their healthcare and the emergency room. How do you really work to get them comfort and understand the importance of getting vaccinated, particularly if it's a population or individuals who don't readily get the flu shot? So we have activated not only our healthcare field here in Connecticut, but also really changed it into almost like a campaign-like feel of going door to door in various communities and really getting out there and saying, what is the information you need and how can we set up an appointment for you? So yes, the vaccine is on emergency authorization. And it's important, and I commend the role of the federal government, the FDA and others in terms of their ability to do the research, review the information, and really make sure they're giving information out there. I think a lot of people took the situation as great alarm on the Johnson & Johnson. I think someone like myself took it as showing that they're actually doing their work and doing it appropriately and making sure people are appropriately updated and making sure we appropriately have safe vaccines. So I take this meeting that's occurring tomorrow as a sign of the medicine and the government working in the right direction.
Wonderful. Thank you, Paul. Another question that's come in: the pandemics of COVID-19 and racial unrest have laid bare the persistent disparities affecting Black, Latinx, and other communities of color, which create barriers to health, well-being, and wealth building. How can your sector, and again, as it applies to each of you, be more inclusive and equitable in addressing the needs of the underserved communities? I'm asking this question because I think Paul, your answer started to address that, and just wanted to give people an opportunity to build on that.
I'd be happy to start. Look, I think inherent in that question is a set of facts, and Paul did recognize it as well. You know, the way we used to do it in terms of access to healthcare, the way to connect, you know, with different members of our community wasn't good enough. We have to do things differently, and if we don't do something different, we shouldn't expect something different to happen. So we're building new operations. You know, we have now started a new division of Hartford Healthcare called Neighborhood Health, and the Neighborhood Health Division will have our caravans housed within it, our teams that are trained and set up to go deliver, you know, care now in a whole series of different settings. And we're building deep partnerships. You know, one really good example, the Open Hearth Center, which is a homeless shelter for men, both in Waterbury and in Hartford. You know, we went to the Open Hearth in last year in March, and we began a every 2 week testing process, and we provided medical advisement to their team around their procedures. And we went every 2 weeks until we vaccinated the entire population in Open Hearth in the February March timeframe a year later. And we had one positive case, I believe, in that entire 12-month process. So that relationship we built with Open Hearth. Now all of their clients are registered within our electronic health system. We have the capacity through Open Hearth to try to connect with those individuals, assign physicians, help them manage their healthcare and be a partner to them in managing their healthcare. So those types of partnerships, you know, it's not there's a macro strategy, and then there's the work you have to do organization by organization, person by person, sub community by sub community. But it's going to take a very focused effort, and it's going to take new capabilities like what we're building through our neighborhood health strategy to do that. And if it doesn't work, we're going to keep measuring it. We built a health equity division. We have 11 people within it, very sophisticated team who measures our efforts so that we can determine quickly what's working, what's not working, and then we have to adjust. But I certainly know we, and I think all of my peers and like organizations are completely committed to addressing this issue. It's absolutely critical, and it's unconscionable that we found ourselves in the position that we did as a state in this moment.
I would just jump in and add it from an economic kind of development perspective. I think, we must be intentional. And I think when you're intentional, you get better results. And it can't be an afterthought or check the box requirement, which unfortunately, I think that's kind of historically how it was handled. And I think, for me in this position and being in the eye of the storm, if you will, particularly, what started off as a health crisis quickly became an economic crisis that disproportionately impacted Black and brown people. Those disparities existed pre-COVID, but COVID really exacerbated them. And so as part of our strategy in deploying rescue funds, whether grant, short-term loans, low interest loans, we were really intentional about making sure that money was getting to those communities, women and minority entrepreneurs, where 50% of the funds that we deployed went to those individuals. And that would not have happened if we weren't intentional and we didn't do it by design. And so I just stress that point. Second, I think we really have to build programming to meet people where they're at. So for example, when we think about workforce development, and as I mentioned earlier, this is a key enabler to our economy and a key pillar of our strategy. And we're going to be making significant investments in our workforce. And in thinking about that, we know that we have high unemployment amongst our Black and brown residents. And so understanding what are the root causes, what are the barriers to them getting gainful long-term employment. And a lot of that is supportive services, kind of the wraparound services, access to childcare, access to transportation, access to equipment. And so how can we build programming that really invests in those type of supportive services, and we're zeroing out the barriers, right? It's like no excuses on why you can't actively participate in this job training program that will yield a permanent gainful employment opportunity. And so again, really reframing how we use our resources, how we design our programming to ensure that we are really focusing on root causes and really using our limited resources to really target gaps, right? And where it's really needed and providing that public intervention.
Fantastic. Thank you very much, Glendolyn. Appreciate that. That was wonderful. Thank you, Paul, Jeff, and Glendolyn, for that very well-rounded perspective. Another question we have is coming from Amanda Noble. Are there or have there been any incentives offered to encourage residents to get their COVID vaccine?
Yes, I won't say that we have gone in the direction of California or Ohio and have multi-million-dollar lotteries. That's a whole different story. But we have created and worked on various incentives, and a lot of those incentives have been worked out of Glendolyn's shop at DECD and the team over there, whether it's in providing tickets to a Yard Goats game that we have done locally. We were one of the first states, I think we're the first one, to do drinks. We did a Drinks on Us campaign where you get a vaccine, you show your card, and basically you'll get a free drink with a meal. We did that. That was like a 3-week campaign, right, Glenn?
Yeah.
And we even made some late night shows because of it, because of us doing that. Yeah, no, there's been various ways of incentives, and I think there's various ways to measure whether or not it is working or have an effect. I think there's various different ways that people serve as a tool for their action. And I think it's key for the state of Connecticut to utilize all those aspects and understand all of those tools. One tool is education, which we have thoroughly went into. Others is through the incentive route. As I said, baseball games, concerts, UConn basketball games, things of that sort. But I think one of the greatest incentive is knowing that your family member got it and them telling you the reason why. I know why I got vaccinated. I got vaccinated because I lost my grandmother to COVID-19. And a person who was extremely helpful for me getting through that process is on this line, and that's Dr. Flax, whose team did the amazing job as long as they can to try to keep my grandmother alive. And that moment woke up all of the doubters in my family. And I wasn't a health doubter, obviously, but I had a lot of them in my family. And they made it their mission, their goal to make sure they get vaccinated in honor of my grandmother. Mm-hmm. So everyone has their own incentive, and it doesn't always have to be the role of government. It doesn't have to be the role of business. Sometimes it's within your own household, mm-hmm. in your own family, in your own neighborhood. And that's what it was for my family particularly.
Okay.
No, and that, just to echo, I mean, that's so important, right? And I think our approach was how to make this personable, and how could we have, you know, leaders and trusted leaders really telling their story on why. And to Paul's, you know, example, something really personal. And there's 1,000 more people that, you know, were in the same situation and lost relatives. And so let's just reflect on that for a moment. But then on the more social side, the Drinks on Us campaign, these are all these activities that we enjoy and we want to get back to. And you having your vaccination, we can get back to doing that, right? And so that was really kind of the approach and the thinking on kind of a more, you know, nominal approach, right? Our incentive, and not being like the Ohio of the world, if you will, but a more pragmatic approach.
Yeah, I would only add, again, I think the state's done an extraordinary job around educating people in the vaccine process. I mean, they've invested tremendously in a grassroots campaign through local healthcare agencies, every community in the state. They've done a massive television and multimedia and social media campaign, and they've supported organizations, you know, like ours and others, to bring our people into different communities to educate. And we also took a multi-pronged approach where we had large vaccination centers. We have 30 some odd community vans on the road, you know, every day, and we're delivering this through every small community and through the local health departments. Which again, I applaud our state. I mean, one very important point, you know, in the early days of our the decision that was a courageous decision was to provide the vaccine through by age criteria predominantly, and the rest of the country went a different direction. But it allowed us to, and I can tell you as a provider, it allowed us to distribute it more expeditiously, to get it to the people who were in greatest risk faster, and we were very quickly able to get to the next level populations. And we adjusted, you know, and did special approaches for people who also had compromised health conditions. But our state led the way because we actually went against the grain, you know, in that decision in those early days. And it's partially why, you know, Glendale said this. I mean, we were the first people to get 70% of the population vaccinated. That's no coincidence. We also had a slightly different approach, which allowed us to deploy it faster. But also, we didn't just go through our mega centers. We didn't just go through our local health departments. And we didn't simply bring it through mobile health capabilities. We did all the above. And I think the flexibility the state showed in the way they distributed the vaccines kind of on a weekly basis based on some type of predictive analytics where they were able to kind of see where the need was, and also targeting, you know, about 50 zip codes, you know, very early in the process to ensure that they had the data. They saw that certain zip codes were not being treated as equitably with the vaccine as others. So we adjusted early in the process, and we got the vaccine to those zip codes much more, and we still do to this day, have a much more focused effort around accountability to demonstrate, you know, the impact we can have within those specific targeted zip codes.
Mm-hmm. You know, Jeff, you actually bring up an interest, or kind of a related point. Just taking notes on your other comments, you talked about that you now have a diabetes test, which can be taken through the eye. You talked about split ventilators. Were these things that existed before the pandemic and they were brought to use because it was a unique situation, or were they created during the pandemic?
Yeah, Matt, it's really both. So, the ingenuity in the pandemic allowed us to move faster. My people say this all the time. Our physicians said that they really believe that the accomplishment of developing a vaccine in 9 months for a virus that was never seen before or existed, and to have this vaccine have a 98% some odd effective rate, they believe is akin to putting a person on the moon. They really do think it's that level of accomplishment. And the scientists are still in awe, right, of what occurred in our country during this time period with this vaccine. And there's never been a vaccine studied more closely in our history than this vaccine, in terms of the oversight and the way it's been delivered, and the way organizations like ours, are responsible for follow-up. So the ingenuity during this crisis allowed us to move faster. So things like you described were in development, but it was accelerated. And then there were many things that didn't exist or could be leveraged. The issues around telehealth. Telehealth was not widely accepted in our country, prior to the pandemic. It was being used in a very modest, very kind of targeted manner, and there wasn't great confidence in it. And at one point during those first 2 or 3 months of the pandemic, the vast majority of community-based healthcare in the country was being delivered through telehealth. So, the innovation that occurred was really massive, and the necessity, right, is the motherhood of invention. And I think we saw that throughout this crisis. I saw such creativity, throughout it, and we saw new practices developed that were so interesting. 3D printers, were used, and we were creating personal protective equipment through 3D printers. And, we never expected to do that. We never thought we'd have to do that, but it was critical when our supply chain was disrupted. So, there's countless examples of innovation. And I think that's something that we probably don't want to lose, right? That rapid improvement cycle is a great thing.
Mm-hmm. Absolutely. Yes. I'm checking to see, we do have another question. Now that we're, let's say a post-COVID world, what would you say was the biggest lesson learned that each of you took away from our experience here?
I would start with, I saw unbelievable heroism by people who work in healthcare. In the early days, it was analogous in some regards to the early days of the HIV crisis in our country, but much broader, meaning people didn't know. We didn't know. We didn't understand this virus. We didn't understand how deadly it may be. We didn't appreciate how contagious it was. We didn't appreciate, the way it might morph, into other viruses. And to see people gown up and go into these healthcare organizations every day, the selflessness. I mean, we always knew, and we would talk about bravery and courage and discretionary effort. But in this case, the word hero is not overstated and it's not overused. And it's not simply, and I say this, our physicians and nurses are extraordinary. It's the people working in environmental services who are absolutely crucial. People working in food services, people working in safety and security, our transporters. It's everyone who is involved in providing levels of healthcare and support services. We've always, every one of us knows when we're in that position and we're vulnerable, how amazingly important these people are to us. But as a country, I think we saw that the frontline responders, and it's even beyond people working directly in healthcare. You could make the same perspective around police and fire and people working in frontline services like transportation. It was unbelievable what people did. And when others retreated, they went in and they kept this country going forward, and they protected people. So, for me, it's something I clearly always knew, but it's so indelible. I'll never forget, what it looked like and felt like. And watching people go in during this experience. I mean, it's really beyond description.
Paul, Gwendolyn, your thoughts?
I'll jump in. I think there's several things, but if I had to narrow it down, I think for me, this experience in crisis really put a new definition of crisis management and what it means. I've been in public service, former city council president. I thought I knew crisis, right? From 11-year-old getting shot to 300 families being displaced via fire, but the speed and scale of this particular crisis was just different. And there wasn't, again, the playbook there. And being able to, the leadership and collaboration, like it sounds cliche and we know that, but it really does matter. And that was kind of those two core elements and tenements of leadership really kind of stood out, like having empathy and collaboration, because we were all, driving the ship and keeping our teams motivated, but they were on the front lines. They were dealing with a whole host of things. And so how do you keep people together? How do you keep them motivated? How do you keep them focused on the North Star and why we're doing this and why we got to keep chugging along? And that's a hard thing to do. And being able to have that empathy as a leader, recognizing where everybody's coming at, because everybody was dealing with their own circumstances, right? And recognizing that this just wasn't a 3-week, 2-month period. This was not a sprint, it was a marathon, and really being able to keep people motivated, keep them focused, keep their wellness, right? And intact. So they could be there for our state and they could do their job, because it was very, very tough.
Yeah, no, it was, and I'll say this, you see my helmets behind me, with my Trinity one. We all had to act like we had to be a team. And the crazy thing about this team, and as I share this panel with two people who I feel were two of my teammates on this, was we didn't have a huddle in a lot of ways. We didn't have the ability to really say, okay, here's the next play. We had to respond and really trust what we've learned in our past to educate us on how to make the right decision. Dr. Flax talked about the transition that the state of Connecticut made on going away from, I would say, an occupational model to an age-based model for vaccination. There's no way that us as state leaders were going to be able to make that decision in March of 2020. Wasn't at all. We weren't prepared to make a decision like that. We didn't have the learning lessons of the year to make a decision like that. Yes, this is public service, particularly where I'll speak for myself, and I work in public service, but I still have to manage politics. In 2020, we would have still thought about the political lens of it. But when we had to make that decision to change from occupational model to an age-based model, we had the learning lessons of the year, the importance of trusting not only the stats and the figures, but people on the field like Dr. Flax and his team, and trusting the people like Glenn, who speaks with business owners every day, and really try to get to the understandable fact of, is this actually actionable, and is it actually feasible to do it like this? We went against the federal government in that decision. It's not that we just went against states around us. We went against the guidance of the federal government, and we made an agonizing decision as we were building up to execute the previous decision. We realized, based upon the conversations, the numbers, and our previous learning lessons, that we had to change. And we had the strength to do it because of what we learned in the previous year. I think there's not a person who can look you in the face and say that they wasn't scared at some point during this crisis. I know the moments of going home every day, getting in the office at 7 o'clock, going home at 8 o'clock and still working. And I have had those moments of doubt. But it was the people around us and the challenge in front of us that forced us to keep going forward.
Mhm.
I wear a hat. I'm a person who wears hats all the time. But the one hat that I bought during the crisis, it just says Connecticut on it. Nothing else. It just found a Yukon hat that just says Connecticut, and I was happy because I felt that we were playing on Team Connecticut. And my mission and goal, and the piece of paper I put in front of my desk says, keep as many people of the state of Connecticut, the 3.2 million people, alive, well, and prospering. That was my mission statement for that year and going forward as we now go for the, I would say, the recharge and the true restoring of our state. The beauty of our state and the people of our state is that our soul didn't go away.
Mhm.
Our drive has actually, I would say, grown, and our ability to actually look at each other not as we do classically in Connecticut. We define ourselves by what school we go to. We define ourselves with what town and what neighborhood we grow up in. We define ourselves by zip code, but we don't define ourselves as one entity of Connecticut. We are all one team Connecticut. And I think that's one thing that I saw during this crisis. And I also learned a lot about myself. I learned the ability to juggle, the ability to manage my nerves, and also the reason why I went to Trinity College in the first place, the love for public service and to learn about it. And I took those learning lessons from Trinity College, from the academic side, and I still use it today, and I used it last year as part of my practical side. So learned a lot about myself, but I learned more about the people of Connecticut than anything.
Oh, fabulous. Listen, that puts us at time. Thank you, Paul, Gwendolyn, and Jeff. Really appreciate it. I mean, I think when it comes down, just to kind of very quickly summarize, quite a challenge, but it sounds like in a very unique and very productive coming together, Connecticut is emerging in a better place. It truly has evolved in how it views many of its citizens, and it's produced a lot of very new thinking about the best way to serve those citizens, and all of them, not just some of them as typically has happened. So with that, I'm going to thank you, and I am going to turn it over to Francesca to close us out.
Well, I just want to thank each of our speakers tonight for providing just really informative information and helpful. And I'd like to thank all of our guests tonight. I hope each of you enjoyed and walked away with a bit of new perspective on how we all are dealing with this pandemic. But as we cautiously, and I say cautiously, emerge from this pandemic, the Trinity Club of Hartford will continue to provide some events and presentations. And so I would say stay tuned, and we hope that you'll join us. And so with that, thank you again and good night.